All right, so the first thing we're going to do is teach you about teaching procedures. We're going to try to walk through all the steps that you would use when teaching procedures and take you through a stepwise process on what you should be thinking about when you're teaching procedures long before they even get into the clinical world. And then we're going to flip and we're going to teach how you can teach procedures just before the procedure is being done, i.e. you are in the department and you realize a procedure needs to be done and you want to make sure that they're up to speed on that. So we're going to take you through a multitude of steps. There's a lot of literature out there that talks about the steps that you need to use. They're specifically coming up on the slide right now. But what we thought we would do is, in order to teach you this, we'll actually have you work with us. So I just need every other person. Let's see. You have one. You will be a teacher a little bit later on, okay? You will be a teacher a little bit later on. If you don't mind, a teacher a little bit later on. You get to teach Dr. Santen behind you. Teacher a little bit later on. So you're going to watch us tie a rope here in a little bit. And then I've got 3 teachers over here as well. 1, 2, and 3. You made eye contact, sorry. Okay, so in order to do teaching, the first thing we need to do is prepare. Right? So preparation is very important when we're teaching any type of procedures. And so the first thing to prepare the learner is to say, what procedure are we doing today?
So I'm going to play the role of your learner. And the procedure that we'd be doing today is tying in a bowline knot. So anybody know how to tie a bowline knot right now? Yeah, one Boy Scout in the room.
Great.
All right.
Nobody else. That's great.
So that's our procedure, is that we'll be tying the bowline knot.
Okay, so what's going to happen during teaching? We're going to actually walk you step by step through how to tie a bowline knot. The second thing is prepare the environment. Make sure you have the right equipment. So for this part, the only thing you need is that piece of rope that we've given you, okay, to prepare for this procedure. For the second procedure we're going to do today, we've got the mannequin and the scope and the monitor. So you got to make sure you have the right equipment. What I find when we're teaching procedures all the time is we choose to make it makeshift, right? We don't have a kit, so let me go get pieces and parts, and you can try with this. I don't have everything you need, so let's pretend. Well, when they're learning a procedure for the first time, that is not good for their memory. That is not good for them to figure out how to do the procedure correctly. So you need to make sure that you have all the proper equipment that you need. The next thing is, before we ever get to the procedure, you should review, why are we doing this procedure? Why would we use a bowline knot? What are the indications for a bowline knot?
A bowline knot's a nice, simple, easy to do knot that easily attaches to something. It can hold something with significant weight and resistance, and it also easily detaches from whatever it is you put it on. And it's a very easy knot to untie. So a lot of knots that are secure permanently. You can't get the knot out later, you just have to cut it. The bowline is a great secure knot that you can unsecure very easily later.
Contraindication?
A knot that you would want to adjust the cinch or the loop of your knot. So bowline, once you lock it in place, the loop's as big as it's going to be. You can't make it smaller later on.
What's the anatomy of that piece of rope you have?
Nylon, I think.
Okay, great. Is there any specific, like you call one end a manipulative end and one end a long end?
So when you're tying the knot, there will be one end that is short. It's your working end, okay. And then there's another kind of static end of your knot. So you'll want to have a short working end.
And the necessary equipment you already have in your hands. So the next thing we would do is, when you're teaching this, you really ought to demonstrate what it is that you're doing. So the expert in the field should demonstrate the procedure without stops, without talking, without anything else going on, just walk right through it. The other thing that should happen is they should demonstrate it in the position that the learner will use it. In other words, if I'm teaching you how to intubate, you standing at the foot of the bed and watching me intubate doesn't work. You had a story about that? With suturing?
Oh, yeah. I was like, do I? Yeah. Yes. So I was a medical student. I learned to one-hand tie. but I learned to one-hand tie by watching and mirroring somebody else one-hand tying. And what I didn't realize was and I always, as a med student, you just grab like the loose suture and you just practice over and over and over. What I didn't realize is I was practicing throwing with the needle end of the suture the entire time. And then one day I was going to show off my one-hand tying technique to an attending and threw my first stitch, and I was like, I can't throw any of these because I'm throwing a needle around as I'm working with my working end of my suture. So learn how to do it in the proper orientation.
So in order to do that, he's going to demonstrate tying a bowline knot.
So this will be, again, proper orientation. All right, and so through our demonstration, this is simply a visual demonstration.
Now, most of you at this moment should be just scared.
Sorry.
Not a bowline knot?
You got me.
Oh, great.
Now you got me flustered.
You're a little bit off if you come down in.
Here, we can do the Boy Scout method. Maybe you can teach me. All right, so this is a technique I actually just learned for this event. Nope, I'm not gonna get it now.
Oh no.
You called me out. Now I'm gonna have to practice again.
Okay, maybe we're doing a square knot. Come on up.
Yeah,
That's
show me.
fine. Come on up. That's okay.
The pressure, that's all right.
If you come down just a little bit, you can watch yourself do it there.
So you're using a different technique on that.
Still the same knot, right?
No, it's the bowline's right here. This is the component that makes it a bowline. So I'll have to look at what I was doing backwards on that.
Okay.
But
Well, there you go. So we should have been able to show you the actual knot straight through. Thank you for doing that. The next thing is that you need to deconstruct the knot.
why don't you, since you got it right, let's deconstruct the knot.
Let me do one.
You're just going to verbally walk him through that knot.
So basically, you have it in your right hand. You're going to lay
Keep
it
it
across.
under the lens.
You're going to lay it across here and then flip over, so that you actually have a circle with the live end coming up underneath. You're going to circle that under then, because this will be. You want to hold this for me?
This is like out of the hole around the tree.
Right, exactly. And so. And one of the things that it's useful for is if you were in a situation where you had to tie yourself onto something, you could, this isn't long enough, but you could then really, with minimum amount of pressure, come through and do that. So it's
And you can work within the middle of the length of rope as well.
switch around, go under, yeah, I like that phrase, around the tree, and then back through the hole.
Yeah, and so and we'll go back to, so I'll go back to the old way I learned it. So the way that works is you rotate, so rope on top, okay? And then the way that people like to say it is the rabbit pokes his head out of the hole, gets scared, goes around the tree, gets scared, and goes back into the hole, and then cinches down. All right?
Did your other way not work?
I'm giving up on it.
You're giving up on it,
We're
okay.
giving up on new methods.
All
We're
right.
going with the tried and true.
So then the next thing to do is to have the person, the learner, vocalize all of the steps as to what they're doing. Okay? So another way to do that is to have the instructor perform while being talked through by the learner. Okay? So we've completely changed.
I've flummoxed you now, but
You've flummoxed me now, but I'll try to put you through the knot that you taught me earlier today.
Okay.
Okay. So you'll grab the short end or the working end between your two fingers. You will go over the rope and then twist under the rope and come back out so that it's setting. You're going to take
so
that.
that's the part that I'm screwing up from when we were learning before. I think we stick with what we got.
With how he did it?
Yeah.
Because
So
I don't know how to do that.
I'll just work your way through it.
You work me through it.
All right. So again, you flip top over, okay? So I have my knot, and then, let's see. Sorry, top over, all right? So the rabbit comes, and you can see if you let your rope get all bunched up, it's just going to get in the way. So rope goes back over the top, all right? Rabbit goes up out of the hole, goes around the tree, gets scared, goes back in the hole. So you can see my knots shaping up there. Oh, and I slipped it up again. It's just this easy, folks. All right, out of the hole, around the tree, back into the, oh, that's what I'm mixing up. It's, there we go. So.
I think the switch we should have made is that you're not worried about tying a bowline knot, tie a bow knot. That would be the easiest thing. That would be the easiest thing.
You want to talk me through it? You seem to got this down.
All right, so lay the, so what you're going to do now to get in your position, right? Because it's
Please.
Yep.
So you've got the left hand, you've got your left hand, the major roll. You've got the long end here and the short end here. You're going to put the short end on top of the, and now just flip your hands over. Just that's right. Now.
So you do it a little differently than I do.
Together. Now go around, back under, pull. That's right. Pull. Now.
Yeah. So then
You want to pull this way, and that's your bowline.
So, and as we're demonstrating, there are multiple different ways to tie this knot. All right. I'm going to square away a solid way before we teach, all right? And then I think we should move on.
Yeah.
I will square away the
Okay,
bowline
so
knot.
the learner performs a task while walking through the steps. I was the learner at this point, and could walk you through each one, right? So the steps that you would go through, I can walk you through. This is what I learned, right, to be able to do that. So if you'll follow along with me, 2 fingers on the rope, right? You take it and you go over and spin under. Once you spin under, this rope is sitting out here. You have to drop underneath and then come back through. And I think that's still a bowline knot. Or is that a square knot? That's our whole problem. Is what Gotcha. That's our whole problem. Is what we trained on was a square knot, not a bowline knot. That'll be a big problem.
Let's call an audible on this, and let's get through to the instruction.
So
part.
supervised iterative practice, so you want immediate correction of the mistakes, because otherwise what you're doing is practice doesn't make perfect, obviously. I practiced again and again and again, not the perfect knot. What we want you to do is practice the perfect knot. So what we're going to have you do now is walk through tying that knot. So you're going to walk through tying that knot and train the person next to you. So the first thing for you to do is just walk through it yourself to make sure you can do it. I'll walk over and work with you.